Okay, so we are, I think, in the last video lecture of this series of this topic. But there's more to come. And for this video lecture, we are going to briefly discuss the universal healthcare, which is the um, program of the government. And I think you have heard this already a few times. I don't know if it's this year or last year that it's again back in the current events or the news. And I don't know if how uh, updated you are or socially aware you are, but this is the main or brief discussion of this program. Right? So, universal healthcare is uh, conceptualized, implemented to address inequities in the health system, especially in when it comes to economy, comes to social disparities, socioeconomic disparities of the Filipinos. And this is also known as Kalusugang Pangkalahatan or KP. And I think this has evolved since it was formulated, it was enacted, it was implemented already. And the concept behind this universal health care is the provision to every Filipino of the highest possible quality of healthcare that is accessible. It should be efficient, equitable, distributed, adequately funded, fairly financed, and appropriately used by an informed and empowered public. Okay, so that sums everything, regarding this program. Okay, so quality healthcare is one of the goals of this kalusugang pangkalahatan, and from the name alone, pangkalahatan is every Filipino, as it's stated in the concept. This quality healthcare should be accessible, should be efficient. This should be distributed to everyone with due justice, with the concept of equity, uh, not equality but equity, meaning it would be for all, but it depends on your need. Okay? It will not be equal for each and everyone. Okay, the provision to rich will not be equal to the poor. Okay, uh, in the sense that if the poor needs it more will be given to this poor population, more will be given to this marginalized population compared to the rich ones, compared to the middle income families or population. So that's equity. Okay, because when you say equality, uh, pantay-pantay. Okay, regardless of the need, pantay lang yung makukuha ng poor sa rich and vice versa. So equity is more applicable, okay, more desirable, and then it should be funded properly, and financed properly, and the public, okay, we should be informed with the happenings, with the provisions, with the um, what's this services being covered by this universal healthcare. So this happened during the time of the Aquino administration, and uh, to simplify, the quality healthcare should be available and accessible to every Filipino who is really in need of this. It's a government mandate aiming to ensure that every Filipino shall receive affordable, quality healthcare benefits. Okay, and it's just like what I mentioned. It covers everything from the different resources, from health human resources to facilities to financing and to services. Okay, so everything. In other countries which have already really implemented this fully and very well. even rich people do not pay. Okay, even rich people avail of public services, and they do not pay any single cent. Okay, then there are three trusts, uh, strategies in this universal healthcare, and this is to be pursued by these trusts. Financial risk protection. Yeah, that's one. This is through expansion in enrollment and benefit delivery of the National Health Insurance Program, being represented by the PhilHealth. Okay, um, improve access to quality hospitals and healthcare facilities, and the attainment of health-related Millennium Development Goals way back 2015, but now it is changed to Sustainable Development Goals, or SDGs, which I already posted in our LMS. Okay, I think we have a few slides for this MDG and SDG. Then we have, okay, to expand further, no, what is financial risk protection? This protection is from the financial impacts of healthcare. So we know that still much of healthcare uh, services are to be paid. Okay, but this trust protects every Filipino from financial burden of these services. Okay? So this is attained by making any Filipino eligible to enroll, to know their entitlements and responsibilities, and to avail of health services, and to be reimbursed by PhilHealth with regard to healthcare expenditures. So this is um, covering the whole population that is eligible. Okay, the word there is eligible. Okay, um, so meaning not all Filipino will be for this one. And I mean, uh, if you're already enrolled, okay, prior to this, so syempre hindi ka na totally covered. Okay? Um, Again, this is being represented by the Philippine Health Insurance. And PhilHealth operations are to be redirected towards enhancing national and regional health insurance system. This nga, the enhancement nga is emphasizing the enrollment, no, of every Filipino eligible for insurance. Okay? The National Health Insurance of the Philippines enrollment shall be rapidly expanded, okay, to improve population coverage. So, mas mapaparami yung pwede mag-enroll sa PhilHealth o nag-enroll sa PhilHealth, because this is way back during the time of President Aquino. Well, that's Benigno for to make it specific. And the availment of outpatient and inpatient services shall be intensively promoted also. Okay? So, this is yun nga, to protect Filipinos from financial risk, from financial burdens, from financial impacts of healthcare. And so basically is to enroll uh, more population under PhilHealth. Then second is to improve, and under universal healthcare pa rin, improve access to quality hospitals and healthcare facilities. Improve quality hospitals and healthcare facilities. So, the quality of government-owned and operated hospitals and health facilities is to be upgraded, or yun nga, improve, and to accommodate larger capacity. Example is CVMC, your Cagayan Valley Medical Center. This will be improved to 1,000 bed capacity. And so your accommodation niya, it will be larger. And, and they attend to all types of emergencies and to handle non-communicable diseases as well, even the pandemic. Okay, so you all know they are the center for COVID cases here in our province, in our even so to speak, in our region. The Health Facility Enhancement Program, or HFEP, we shall provide funds to improve facility preparedness for trauma and other emergency. Example, again, is a pandemic. Financial efforts shall be provided to allow immediate rehabilitation and construction of critical health facilities. In addition to that, treatment packs or packages for hypertension and diabetes shall be obtained and distributed to RHUs. The DOH licensure and PhilHealth accreditation for hospitals and health facilities shall be streamlined and unified. Okay? Ayan po. So basically, this is to improve uh, the the access to quality hospitals and health facilities, and this shall be achieved in a number of creative approaches. Uh, and the aim of your health facility enhancement program is to upgrade at least 20% of DOH hospitals and 46% of provincial hospitals, 46% of district hospitals, and even 51% of rural health units. But again, this is way back during the time of Aquino, and I think the percentages is already being met, and they try to increase still the coverage of these quality hospitals. And third thrust is the attainment of health-related MDGs, or your Millennium Development Goals. And to translate it in the present time, this is already your Sustainable Development Goals. Okay, so efforts are being made and resources are being created to be applied on public health programs to reduce maternal and child mortality, morbidity, and mortality from tuberculosis and malaria, and incidence of HIV/AIDS. So we know that under your MDG and SDG, there are lots of goals. But here in my presentation, I'm emphasizing those are or which are health related. Okay, so we have their maternal mortality rate, child mortality rate, and even morbidity cases related to tuberculosis, to malaria, to HIV and AIDS. Okay, so localities shall be prepared for the emerging diseases. This is way back 2011, I think, and to relate to this, we have emerging disease of the pandemic way back February, March, April. Okay, and the organization of community health teams in each priority population area. Another effort will be given to the provision of necessary services using the life cycle approach, which um, is usually catered by different agencies, government agencies, not only DOH, but this is in coordination with other agencies like DSWD, even Department of Education, and to make it local, on a provincial level and municipal level, we have the Department of Interior Local Government, okay, agencies. And this is very essential, the coordination among these departments, agencies. This is very essential for the achievement of these sustainable development goals. Okay, and just to present also here, this is the MDG that I'm referring to, or the Millennium Development Goals, which already uh, if I may use the term, expired or terminated or have changed to SDG. So we have 8 MDGs before, and so health related are, we have 5, 6, and even 4. 4, 5, and 6. And reduce child mortality, improve maternal health, and combat HIV/AIDS and tuberculosis diseases. And after your MDG, these were translated to SDG or your Sustainable Development Goals. And so, from 8, naging 17 yung development goals. Okay? So, this is already posted in our LMS, and you may refer to this video later after reading, okay? Or you may start this one then read. It's up to you. And thank you for watching this video lecture. I hope this will help you in your study in or studying community health nursing 1, and even in your review later on, especially on the different examinations. So thank you, and God bless everyone. You're a blessing. Bye.